Are you scared about taking finasteride, which your doctor has prescribed, or you already are taking finasteride? In this video, we are going to discuss what does scientific basis and evidence suggest about finasteride and what are the most common 5 side effects of finasteride. Hi, I am Dr. Satya Saraswat, a hair loss and hair transplant American board certified specialist, and in this field for last 17 years. In this video, we are going to discuss about finasteride, and in the end, I will tell you a special tip how you can minimize the chances of these side effects of finasteride, about which everybody almost nowadays is scared about. If you like this kind of content on our channel, I request you to subscribe to our channel. Before we discuss about the most dreaded sexual side effect of finasteride, I would like to bring to your notice another important side effect which has recently been described a couple of years back by Dr. Tube and his colleagues. These are emotional and psychological disturbances which have been reported due to finasteride. This paper was published in 2021, which said there can be emotional disturbances and emotional side effects like sadness without any reason when you are taking finasteride, depression, and in extreme cases there have been suicidal tendencies reported with finasteride. Whereas this looks very scary, but these reports of these kind of side effects started happening after 2012, and that was the year when the post finasteride syndrome was first described in the literature. So some doctors and some scientists also think that this may be due to nocebo effect. Now, what is nocebo effect? Nocebo effect is a condition where you feel the chances of a side effect or a complication happening, especially when you know about it. Suppose you are a very pain sensitive person. You go for a dental procedure or any procedure which requires a needle prick. Even before the needle prick has been given, you start feeling some pain. And if even a small amount of anesthesia has been given by a needle, a simple pin prick is given, you feel extreme levels of pain. So that is a nocebo effect, and some doctors think that just because when people started noticing these reports about post-finasteride syndrome, there was increased issues about anxiety, depression, and suicidal tendency. So there is no certain proof that this is associated, although some companies have started describing this in their literature about the finasteride which is given in the pact. If you think this information is good for you, hit the like button in the video. Now coming to the most dreaded complication of finasteride, which is the sexual side effect. Generally, these side effects are observed in 1 to 2% cases who are taking finasteride 1 milligram for a duration of time. The common side effects seen are erectile dysfunction, decrease in sexual libido, decreased performance, decreased quantity of semen. Although these things are commonly observed in the general population as well, in around 15 to 20% population, but it has been observed that people who are on finasteride also get these side effects. This collective term for these side effects is known as post-finasteride syndrome. Although a counter argument being given by many doctors is that this hair loss generally happens in the people who are in their 20s and 30s, and they are very anxious about their appearances, how they look in the society in which they work or they move. So these people in generally are quite anxious about these problems. So they have a higher chances of experiencing this side effect because of the underlying anxiety and depression about their medical condition, that is a hair loss condition. If you have taken finasteride, or if you have heard about it and you still have more queries about finasteride and its associated side effect, I would like you to comment in the down section below so that we can address it up to your concern. Now coming to the side effect number 3, that is orthostatic hypotension. So what does it mean? Friends, you must have observed when you're lying down for a long duration and suddenly you get up from the bed or your chair, you may feel a dizziness that your blood has drained out and you start feeling some dizziness when you get up. So that is known as orthostatic hypotension. People who are taking finasteride reported this hypotension when they get up in 9 to 18%, which is very high number. But don't worry about it. Start taking finasteride in your evening hours or before going to bed. Then you will experience this less and less, and your body will get accustomed to taking finasteride, and then you can change the time at which you take finasteride. Finasteride does not have any interaction with food, so you can take it even before, just after taking food, or any time. So you can adjust the time at which you take finasteride. Common side effect, but not dangerous at all. If you are having hair loss and you want to consult a doctor, or if you want to consult us, you can call us at the numbers was mentioned in the video. Now coming to a very important side effect, which is association of taking finasteride with chances of getting cancer of prostate or prostatic carcinoma. So friends, a very detailed study was done in Japan some years back, and this study was done in men who were above the age of 55 years and had taken finasteride 5 mg for more than 7 years, and 18,000 people were studied and followed up for a duration of more than 7 years. So what they found out was that finasteride decreases the level of prostate specific antigen. So this is an antigen used to detect the levels of prostate cancer. It's a biomarker or a carcinoma marker for prostate cancer. So if your PSA levels are high, there is a definite chance of you getting a prostate cancer. So this is routinely being performed on yearly basis in many of the Western countries. So what they found out in people who were taking finasteride, that the average PSA levels were less in these patients. Also, these people who were taking finasteride 5 mg had 25% less chance of getting prostate cancer. But paradoxically, they found out as the PSA levels were high, some of these people had high-grade prostate cancers. So when they were detected, because the PSA level were low, but the disease, if it was there, was spreading. So the cancer, when was found out, was of a higher grade than the one which is normally found out in people. So this is the association of finasteride with prostate cancer. If you have taken finasteride and other medical therapies and treatment, and you are planning about hair transplant, please click on the link given above to know about the cost of hair transplant. Now, before we go to the last serious side effect of finasteride, we would discuss how you can decrease the chances of your sexual side effect with finasteride. These 1 to 2% side effects were seen when finasteride was taken 1 mg per day. But you can decrease the dose of finasteride to thrice a week or even up to twice a week. So you can say take it Monday and Thursday, or you can take it Monday, Wednesday and Friday. This really decreases the chances of side effect, and at the same time, because the finasteride remains in the blood circulation for a long time, the positive effects of finasteride will be there, but the chances of side effects will reduce. Second way of reducing the chances of side effects are that you can use finasteride as a lotion form in combination with minoxidil. So generally minoxidil 5% is combined with either 0.1% finasteride lotion or 0.25% finasteride lotion. So what happens is this does get absorbed, but chances of side effects are less, very less, and even if they happen, in almost every case these side effects are reversible, which means even if you perceive some sexual problems with finasteride, once you stop it, it's going to come back to normal. The third alternative is to choose dutasteride rather than finasteride for hair loss. So there are 3 alpha reductase enzymes, 1, 2 and 3. Finasteride acts selectively on type 2 and type 3 5-alpha reductase, whereas dutasteride acts on all the 3 5-alpha reductases present. More effective, almost 99% cases it is effective. The dose is 0.5 mg twice a week, but you have to confirm with your treating doctor. But the only problem is it can cause side effects, but if you want to stop it, it has a very long half-life, which means dutasteride remains in the blood circulation for a very long time, so it will not be washed out, and the chances of reversing the sexual side effect after dutasteride are low, and it takes a lot of time. And the last way in which you can reduce the chances of side effects by genetic testing. So now there are swab tests where they take out your DNA and test it in laboratories, and you get a specific answer what is the problem which is causing and which medicine exactly and at what dose is going to help you out with your hair loss. So these tests are now becoming more and more common. They are currently on the costlier side, but hopefully the cost will come down to a lower level very soon. So these are the 4 ways in which you can decrease the sexual side effect of finasteride. So if you find the content useful till now, please share this video with your friends, your colleagues, or people you know who are suffering from hair loss and planning to take finasteride. Coming to the last side effect, this can happen on your secondary sexual organs. You can get increased enlargement of your breast. This can be on one side or both the sides. Sometimes there may be some pain in the testicular pain. These side effects or deformities can be seen if a female is taking it. There are chances that these side effects can be seen in the fetus. So if you are a female taking finasteride, please stop it if you are planning your pregnancy, because this can have some serious side effects on the baby which is yet to be born. Subscribe the channel button to know more about such content. Click on the left button to know about the testimonial from one of our operated hair transplant patients.